I must apologize very quickly. I ran out of space on my memory card, and so I'll just quickly, I'll probably end it here. So pan-unseen acinas emphysema destroys the entire acina. So this is the acina membrane. So it destroys everything which is contained within that membrane. And we also have irregular emphysema. Irregular, which really we can't, there is no pattern to it. So really we cannot describe it in terms of how we have described the central acinus emphysema that spares the alveolar sacs and ducts, and the panancinus emphysema that destroys everything in there, including the alveolar ducts. So when it destroys, you end up with an alveolar that looks like that. And emphysema, as emphysema goes on, and usually the panancinus is seen in people with alpha-1 antitrypsin deficiency. And as emphysema progresses, it actually, emphysema progression, it doesn't matter what type, progression leads to a bullae formation in the lung. And the bullae really is destroyed airways that have lost definition. Instead of, if we think of that alveolar sac looking like that, so we end up with a bullae which looks like there, and this is is healthy. It has ducts which allow air from the terminal bronchiole and vice versa. So this one ends up looking like that. So it loses all of its definition and all of its ducts. And in doing that, it enlarges, and it's enlarged. So it is poor in gaseous exchange and causes air trapping. Bullae can be treated surgically with a bullectomy, but obviously that then looks again at you have to do the VQ as in the ventilation and perfusion matching. So if there is ventilation and perfusion mismatch, or if the person is suffering as in their gaseous exchange is not very efficient, you can then remove a section of the dead lung tissue that's not functional